Hello, welcome to Prenatal Yoga. I am Selena. Before we get started, I want to make sure you have the proper props on hand, and they don't have to be fancy yoga props. A hard foam block such as this can simply be a container that you can bring in later, or a rolled up blanket or towel will work as well. If you want, you can grab a big pillow, like one off of your bed or couch would work as well for later on. All right, so get yourself set up. And when you're ready, we're gonna come to a seat. So bringing yourself down onto your bum, whatever comfortable position with your legs you wanna do, just make sure you're in a position where you can roll your pelvis forward and sit up high in your seat, making sure your ears are stacked over your shoulders are stacked over your hips. If you want, you can close your eyes, and this is our centering. This is just our simple focus inward, shedding off the day, shedding off the past, the future, and bringing ourselves into this present moment right here in the now. So, taking nice big abundant breaths. Push them right deep into your belly. Feel your belly expand as you nourish baby with each cycle. Feel those physical areas in your body that are clinging to stress. Feel them melt and wash away as you exhale. So our breath is our anchor. It's always with us to help get us through a challenge. Your next big challenge might be your birth. And your breath is one of the most powerful tools that I can offer you to help you cope, to help you manage like a rock star. So keep feeding your belly, keep feeding baby deep, nourishing breaths. In and out through your nose. Make each cycle long, make it complete. So there's different kinds of breathing that we can practice depending on the situation in front of us. So if we're wanting to find calm and peace, wanting to help focus inward, then this simple in and out through the nose can be a great way, a great tool to have in the back pocket. If you're faced with a physical challenge in your body, say a contraction, then using an out breath can really help with the sensation that you're feeling around that rush or that wave. An out breath is when we extend the exhale longer than the inhale through an open mouth sigh or audible vocal toning. So you can try it now as you inhale through your nose, exhale long through your mouth. Or maybe on that next exhale, you want to try a horse slips. Inhale through your nose and horse slips long. Maybe a waterfall. Try again. Inhale. And exhale. Or maybe you want to try the most effective one, being the moan, really low, really chesty. Inhale. Oh, beautiful. And then just steady that breath. When you're ready, gently open your eyes. Okay, so did you know, you can give your legs a little beat out, extend them long. Did you know that when you send that deep vibrational sound, that vocal toning, it actually sends a signal to your pelvic floor to open up and soften. And this is the area baby will be descending through. So it's really great tips to help you vocal tone, send that vibration down, as well as helping to keep your bits open. All right, so bringing the feet together, come to sit up nice and tall if you've lost that tall seat. And here we're gonna start to round our way around. Now, making sure as you come back, you don't do that reverse sit up. So just coming back through your center, through neutral, and then sweeping as far forward, side to side as you can. You can round your spine if you want to, as you're doing these big Sufi grinds. So this is really great for if you're feeling any hip soreness during your pregnancy. So as your pelvis shifts and opens with all the relaxin flowing through you, it could sometimes put a few pain points in and around the pelvis and being around the hips, the sacrum, like sciatica pain. And so moving, getting a little bit of fluidity in there, help to lube up the joint, can be a really effective way to help reduce that sensation. Let's loop around in the opposite direction now. Encouraging as big movements as you can, side to side and forward. So anytime you feel like you're holding on to extra stress or tension in the body, throw an out breath into your practice. So it's just a big inhale through your nose and then a big long forceful exhale out through your mouth. And it could just be a sigh. It doesn't have to be anything more than that. But when you're birthing, you're gonna get noisy. So sometimes it's good to practice that now in class. All right, coming back up through center. Give the knees a little bob. And we're gonna sweep the feet around and behind, coming up onto all fours. If your wrists are giving you trouble here, feel free to come on down to forearms. And of course, you can always pull in your props to put them underneath as well. Give the hips a little shake, a little sway from side to side, kind of like you're taking baby for a dance. Yeah, good. All right, and then coming back through stillness, let's move through cat-cow. I'll show you from the side view. So this is a nice neutral spine. Stay here with the spine, but as you inhale, let's lower the shoulders down away from the ears and take your gaze up slightly. As you exhale, coming into that angry cat, back, round your spine, push up through your heart center and drop your head. Take your gaze towards baby. Inhale, come right back through neutral spine, gaze up, set your shoulders on your back. And then exhale, round. So again, we're just lubing up the joints of the spine. Keep moving, keep flowing with your breath. When you find this gentle movement, it helps to create a little bit of fluid around the joints, which help deal with achiness or soreness that you might be experiencing. One more cycle, in and out. Take your time, take it slow. There's no rush. Good. And then come back through center, through neutral spine. All right, we're gonna extend the right leg long behind us and plant that toe mound down. Come into a big, juicy calf stretch. So push your back heel towards the floor, and you'll feel a nice juicy sensation right up the back of your calf, maybe even up through your leg as well. So this is your go-to pose for if we're ever on our knees and we're doing a pose or a movement that involves us to lift that leg up. And if you feel when you lift that leg that you got kicked in the crotch, SPD is symphysis pubis dysfunction. It's kind of a clunky name. And so if you ever feel like you got kicked in the crotch when you lift up a leg, please modify, don't grin and bear. Put your toe down and come into this glorious calf stretch. All right, when you're ready, you can lift up that leg, check in, how does that feel? Otherwise, if it doesn't feel good, you just put that foot right back down. So charge up through that leg and charge it all the way up to the top of your glute. You feel that charge? Imagine a beam of light is shining out of your heel. Now try not to raise your right hip up. Try and keep your hips level to the floor. Good, and now we're gonna bend in the knee and take a peek behind you. Make sure your joints are stacked and in line with your hip, so your knee's not way out to the side. When you're ready, raise the roof. Take it up just an inch, no more than an inch. Just a little pump with that leg. And what we're doing is we're strengthening this muscle right here, the gluteus medius, which helps to stabilize the sacrum. Remember your shifty pelvis? Yeah, well, your sacrum, this big bone here, is part of that pelvis, and it's gonna move around a lot during your pregnancy because it needs to shift a lot in order to get baby out when you're birthing. So let's strengthen that area so it's not so shifty and giving you trouble like sciatica or SI joint pain during your pregnancy. Good. Lower down, give those hips a little shake out, check in with the wrists. Remember, you can always bring it down if you need to. Opposite side, extend the left leg long. Let's find that calf stretch. Fists is an option too. I like to do fists. Anytime you straighten your wrist creases out, it helps take some of the pressure off of the joint. Good. Remember your breath, always coming back to it. When you're losing focus, when distractions entering into your space, it's all good practice now to bring your focus and attention back inward by bringing it to your breath. Yes. Beauty. All right, are you ready for those sunbird pumps? If it feels good for you, lift up that left leg, shine the beam of light out of your heel and charge up to your gluteus medius, right up to the top of your bum there. Okay, bend in your knee, check your points, heel stacked over knee, knees in line with hip, and then raise the roof. Now, if you raise it more than an inch, you're gonna actually turn on your big glute muscle here, the gluteus maximus. So we're trying to just charge up the top of the glute, the medius, the smaller muscle. For most of us, the weaker one, because that's the one that's gonna stabilize and hold that big sacral bone still. Keep breathing. Your muscles, they need your oxygen in order to function properly. And guess what? Your uterus is a muscle. So when you're birthing and it's contracting, pushing baby down, your breath is so essential to the optimal functioning of that muscle. Good. And then slowly lower down. Big swivel with the hips. Good job. Coming back through center. We'll walk our way back up and up and up to kneeling now. All right, so take your hands to your hips. We're gonna swivel the right foot around in front and just heel toe it out to the right so that you feel you're comfortable. You're not gonna fall over from one way or the other. Still kneeling up nice and tall. Guide your right elbow down your leg. Inhale, sweep up with the left arm. And then exhale, just find a gentle side stretch. So it doesn't really matter how deep you're coming here. What matters is that you're opening up to the sky with your heart. Settle your shoulder down away from your ear and feeling a big expansiveness through your rib cage. Your rib cage is also opening up during pregnancy. If you're into the 3rd trimester already, then you're feeling it, that opening of your rib cage to allow for space for all your organs to be pushed up and under. Okay, so these side stretches are really beautiful to get into, especially during the later stages of your pregnancy. One more breath. Inhale, make it an out breath. Keep going. Those out breaths have to be longer than the inhale in order for them to work so well. All right, come back up, hands to hips, and guide your way back in through to kneeling. Left leg loops around. Find that sweet spot so you're not gonna fall over. Guide your left elbow down your leg, and then inhale, reach and lengthen, and then exhale, find your side stretch. Step by step, here we go. Moving into a shape that feels good for you right here, right now, today. Especially if you're into the 2nd and 3rd trimesters. You know baby's growing at a rapid rate. Things are shifting a lot in your body. New hormones are being introduced, and so you wanna make sure you're constantly checking in. How does this feel this week? Okay? How does this shape serve you right here, right now? And that is practice for your birth. Constantly checking in, constantly refocusing. Big out breath, final one. Inhale. Slowly come back, hands to hips, and coming back in through kneeling. So whenever we get up off the floor, I always encourage you to do it with both sides of your body. So through a squat, but it doesn't have to be a fitness squat. Take your hands to the ground, curl your toes under, and lift your bum up first for a ragdoll to stand, okay? Which means your head is heavy, your arms are heavy, and your head will be the last to arrive at the top. All right, stepping into the center of your mat. Let's find our mountain pose. So mountain pose, as you know from doing classes with me in the past, very, very essential to making sure that you're tapping into that proper alignment as you move into the later stages of your pregnancy, because you don't want to compensate for big baby belly out front and then start to thrust the hips forward, tucking the tailbone under, and then essentially rounding the shoulders. We don't want this S-shaped body, because going into postpartum, it will mean many things, but it will definitely mean your pelvic floor and your core aren't functioning and triggering properly. And so what we want to do is find this mountain pose, stacking ears over shoulders, shoulders over hips, and hips over heels. Okay, all four corners of your feet rooted equally into the floor, so don't put all the weight into your heels. And then imagine a beam of light or a string pulling you up from the crown of your head. Your chin sits parallel to the floor. Roll your shoulders up, back, and then settle them down, almost like you're setting the blades onto your back. And then I like to bring my palms forward, helping to open up the chest. This is mountain pose. Lots of fine cues here, all of them helping to ensure that you are in that optimal alignment as baby belly starts to grow. So make sure you're blossoming your bum. Yes, you feel that? Okay, let's move into chair pose. I want, as we sit down, you to integrate all four corners of your feet equally into the floor. So inhale, we're gonna sit down into chair pose. Blossom your bum as you come down. Okay, so we're gonna feel now how that energy of our breath can help fuel our muscles when they're feeling tired or exerted. Just like when you're birthing, your muscle here, your uterus is gonna feel tired. And so how we can use that breath to keep going. It's gotta be powerful, it's gotta be vocal, noisy, it's gotta be deep and vibrational, okay? So let's try horse lips together first. So big inhale, really force it out long. Inhale for waterfall. So good. One more moan. Oh, yeah. All right, on your next inhale, reach up overhead, extended mountain, and then exhale, bring it down. Give those shoulders a little roll out, give those legs a little shake out. All right, come into the back of your mat. Let's genie squat our way down. So we squat our way to get up, and we squat our way to get down. So avoiding that lunge to rise or lower, okay? It can put too much weight on the psoas muscle as belly starts to grow, and we want to avoid doing that. So we're gonna prepare for our Savasana now. Short and sweet class. You can pull in any props that you want to for class. So as I said, this container or block that you have can be a really nice placeholder here to then set your pillow on top of. So making this kind of reclined bed here. You can bring your hip up to the bottom of it. And if you want to, connecting your toe to your knee, you can find this gentle twist as you settle your way down. This could be used for all trimesters, for all stages of pregnancy. But as you come down, you're just gonna check in. Does this feel good? If it doesn't, adjust. The only contraindication I give for Shavasana is how to get down and into it. So try and avoid doing the reverse sit-up to get down. Either use your arm muscles to lower your way down by turning off your six-pack area, or simply roll onto your side and navigate your way down like so. And then from there, you can lay on your back, you can lay on your side, you can lay on your tummy if it's comfortable. I mean, you know what's best for you, right? I'm gonna stay in a seat. But get comfy, get cozy. There's no wrong way to do this. When you're there, I want you to close your eyes and bring your focus and attention back here right now to this present moment. So if there is one word that I can offer you as you lead up to this journey of birth and into motherhood, that one word of advice that you can embody and embrace with your heart and soul is to surrender. Be like Elsa and let it all go. Surrender means you're accepting what's in front of you, whether that be a challenge or whether that be a difficult time or period in your life. You are accepting it, letting it go, not sitting with it, not letting it fester and dwell, continuing to move forward, staying right here, right now, in this present moment. And how do we do that? Well, there are many ways you can stay present. Today we are talking about the breath. So bring yourself back there. That anchor that is always with you, your breath. Feel how it fills your belly, how it nourishes baby with each expansive inhale. And notice how your body, your muscles and joints and ligaments feel as you exhale, finding that softening and release. And stick with that easy rhythm. Your mind starts to wander away in the silence and in the stillness, which is very normal. With compassion, gently bring it back. Refocus. Practice for birth, practice for motherhood. Slowly, you're going to start to deepen your breath now, gently awakening your body. If you're lying down, you can find that movement in your arms and legs, maybe rotating your head from side to side. And if you're not already there, roll on to your side and use your strong arm muscles to ragdoll your way up and up and up into your tall seat. Thank you so much, everybody, for joining me here, for sharing your practice in space and time with me. The light in me honors and bows to the light in you and the little light inside of you. Namaste.